Welcome. I'm excited to share with you really simple tips to create sinus drainage using just your fingers. For this, you're going to want a tissue because we're going to do some things where you're going to need a tissue. So let's get started. And while we're doing it, I'll give you some information that'll be helpful. The first thing is sit up tall. If you sit up tall on your sit bones and your head is aligned over your spine, it relaxes the muscles and the drainage happens through the muscles. So the more upright and relaxed your muscles can be, the easier it is to create the drainage. You can also do all of these things lying down, which can feel really good when you have sinus congestion. So the sinus is drained from the back of the jaw down the neck, more on the left than on the right. So you want to let's start by creating space around the collarbones. So lift your collarbones forward and grab pinch around your collarbones, breathe. And then let your shoulders hang a little bit and just press your fingers in so that you are softening the tissues. If your fingernails are long, it won't feel very good. So you have to if you have long fingernails, you have to go on the sides of your fingers and move along the collarbones in places that you can find. So you're breathing and massaging. So that's the first step. And you can do this for quite a while. And I'm at the end of a sinus infection, but even at the end, when I do this, it starts to create drainage and I can feel it and I make that sound of pulling it out of the tissues. And the way infections get out of your head and out of your body altogether is through the lymph system, which then that where you feel that you can make that sound where you're pulling the mucus, it goes into your digestive tract and out your digestive tract to get rid of it. So the lymph system is a really passive system that moves through in the space between the cells, in the fluid between the cells. It's called the interstitial tissues, interstitial space. So it's a fluid space in the cells. So let your arms hang down, shake out, breathe, and just from that, see if you notice anything. So then let's start around the jaw. So bring your thumbs underneath your chin and start to massage along the jawline. So I find that a lot of congestion infection can live right underneath in this area. So you massage along this place, along the jaw, toward the back angle, and underneath the chin, there's the muscle. The tongue has 3 layers of muscle. So you can massage from the chin back towards your neck. There's a bone at the base of the jaw called the hyoid bone, where the muscles attach. And so you can help just create that movement in the tissues. Let your arms shake out again. Breathe and see if you feel more drainage happening. Then go back to the jaw and go up toward the ears. And I have a skull I'm going to grab to show you. So you are going along this back angle up toward the ear. And here's the jaw. So this is how the infection gets out of your body, out of your skull. This is one of the primary drainage parts. There's more drainage on the left than on the right, but there is drainage on the right. So you're massaging in this space in front of the ear and behind this bone of the jaw, which is called the mandible. And let your jaw hang, let your tongue hang, and massage around there. You can massage on top of the joint, breathe. And even if you don't have sinus congestion, it feels crazy good and super relaxing for your whole skull and your whole body to do these this little massage things. And let your arms shake out just from having massaged around the TMJ. Breathe and feel the benefit of that. You might feel that there's just feels a little wider, a little more opening. And now go in front of the jaw to the temporal bone. And as you press up into these bones, let your jaw hang. So it looks like this. I'm breathing and I'm pressing up as I let the jaw hang. Breathing. So all along this line, all the way to the nose. And then one thing I love to do, there's muscles here that connect around the mouth. It feels so good to press up and then stretch the jaw down. So you go. It gives you like a little tone to the facial muscles as well as creating sinus drainage. Then now we're getting around the eyes. So as you know, if you're here watching this video and you get sinus infections, the infection is also around your eyes. So do that same thing around the eyes. As you press up with the fingers, let the jaw hang down, and you can stretch it down if you like. And you can keep going up, up, up into the forehead. Breathing, pressing up. One more like that. Then let your arms hang down. Feel the effect of that. And let's go around the ears. So the ears, you massage around the ears, and while I give you some information. So the bone that's around the ears is called the temporal bone. And because it's the temporal bone is part of where the drainage starts out of the skull, the more space you can make around there, the more helpful it is. So just go behind the ears, let the jaw hang again, and start making some little circles around behind the ears. Breathing, letting your tongue relax. You can also stretch your tongue forward. It's called the lion pose in yoga. As you massage back here. And now this time you're going to massage behind your ears and traction up as you let your jaw hang. So it looks like this from the side. One more. And then let your arms hang down. Breathe and feel the effect of that. Does it give you more of that, like more drainage? That's what we're looking for, is more drainage. So from this back place right around the ear where you were, we're going to go around to the back. So this bone in the back of the skull is called the occipital bone. And right coming out through the center is your spine. And the muscles that go along the base of the occipital bone are called the suboccipital muscles. Sub meaning underneath. And we're going to soften those. And that's another place where drainage occurs. So you're going to go from the back of the ears. And you're going to just, as you breathe deeply and relax, you're going to make circles with your fingers, softening the suboccipital muscles. And you can actually create nodding in your skull by working on these muscles. And what I find when I'm doing it is I'm getting sinus drainage. That's why I do it. That's how I learned all this stuff. So what happened to me is when I was 35, I had thyroid cancer and had a very long surgery, and I lost a lot of the lymph nodes, 13 of the lymph nodes in the left side of my neck. And I was still all right. And then with thyroid cancer, you have radiation treatment. And the radiation treatment was a bit too much for my body. That's actually an understatement. And it destroyed the rest of the lymph nodes in my neck. And I went from being super healthy professional athlete to someone who had chronic sinus infections and could not get out of bed for months at a time. And so that's how I figured these things out over the years of trying to get help to create drainage in my head. So what would happen is I would get body work done and I could get my head to open up, but I could open up, but I couldn't get it out of my head. So I figured out through trial and error and different kinds of help that manually I could massage my face and my skull and my neck and create drainage. So what I have, let your arm shake out now and feel the effect of having worked on the tissues in the back of your skull. Did it create more drainage? Because there's also drainage that happens through the back. The sinuses are not just in the front, they're in the back. So that can create more drainage. And also that can help your shoulders relax, which feels really good. Let's go back to the front. And I want to go back. So go back to the temporal bone around the ear and then go in above the ear, but in front of the ear, on the side of the skull. It's right here. The bone here is called the sphenoid bone. And what's interesting, you can do it on both sides. What's interesting about the sphenoid bone, breathe, let the jaw soften, let the tongue soften, is the sphenoid bone goes to both sides. It's one big bone. It's like the shape of a butterfly, really. And it can facilitate sinus drainage, and also if it gets really tight around it, it can feel like it impedes sinus drainage. So you're massaging the part of the sphenoid bone that you can feel from the outside. Breathe, keep that going. I want to show you something. So you're massaging here in this space, right in there. Now look at this. And then you've also massaged underneath there. This is the temporal bone. This little bone is called the zygomatic bone, but don't worry about it. And look at how it's muscle in between those 2 points. So you're here up on the sphenoid, and then there's the temporal bone, and there's a space underneath the temporal bone, temporal arch. And in between those two, that bone with 2 places that you're feeling is all soft tissue. Let your arms hang. Breathe. Soft tissue is 72% water. Remember, it's through this fluid space in the tissue that the lymph moves the infection out of your body. So you also want to drink tons of fluids when you're trying to get something like this out of your head. So by having this knowledge and the image that this is soft tissue and the infection is in the tissue, so by massaging it, you're moving it from the tissues into your digestive tract and out of your body, which is what we all want when we have things like this stuck in our body. And breathe. Let your arms shake again and relax. So next, go the nose, go on the nose, go on the bridge of your nose and then go down. So this part is bone. And then when you get, so this guy, this is Ed, is my skeleton's name. So you can see he just has the bone, and at the end of the bone, we have all this cartilage, which we all have. So massage the cartilage because the tissues, the infection lives in the cartilage tissue. So you can move the tissues of your nose and move the infection from those tissues out of your head. So great, isn't it? Moving the cartilage. Then go down to the lips. So traction your lips. So I'm wearing lipstick because I'm doing a live stream video, but you're not wearing lipstick. So you can actually grab, if you are, you can put it on again. You can actually grab your lips and traction it away, stretching the space between your lips and the gum tissue because infection hides in there. Same with the lower part of your mouth. Traction the lips away, creating like an opening in the space where, once again, where congestion can hide out. So what I noticed over the years of struggling, really for 21 years, I struggled with the sinus infections. It got better after the first 10 years, it got better, but it was still, if I would get sick, could easily be sick for months at a time because it took so long to get it out. What I discovered is that lots of people who still have lymph nodes in their neck and didn't have the kind of dramatic experience that I've had, struggle with sinus infection and struggle with getting the infections out. And so I wanted to make this video and share these tips for what I have learned for getting the infection out of the head. And I end up just repeating the things that I've shown you so far. Now we started here at the bottom, and we're going to go down, work on the neck a little bit. So there's these big muscles here on the side of the neck. It's called the sternocleidomastoid muscle because it goes from the sternum up to the mastoid bone, which you felt behind the ear, this bone right behind the ear. Actually, that muscle goes all the way back around, all the way to the back of the skull onto the occipital muscle. So let's do some work on that muscle because it really helps with drainage. So if you put your fingers around where you think it might be and turn away from the side where your fingers are, you'll feel a big ropey thing come into your hand, and that's this sternocleidomastoid, called SCM for short, for obvious reasons. And then go over to that side so it'll soften it, and gently grab it. And there's a zillion different things you can do here, but let's just do a little tractioning forward and back, and then a little lean away from it and traction it a little bit out. Can you see that? I'm just sort of lifting it a little bit away. And then I'm going to go down toward the base of it. Breathe. Lean into it. Move it a little forward, back. Lean away from it. Let the jaw go. Traction it a little up. And then let's go up near the top of the SCM. So I'm going to get a grip around it. Let the jaw go, breathe, lean over into it. Do that little forward back tractioning, picturing the muscles being fluid. Muscles respond to fluid imagery. They respond to the idea of fluidity and softness that makes them more effective. And then lean away from it and traction it up a little bit. And then massage that down, because that's where drainage happens. It goes down. And breathe in, see if you feel a difference in the two sides. I feel more drainage happening on that side. So here we go, second side. So you're going to get the side of your index finger and your thumb and define the muscle in the beginning. It's a little tricky to find because the neck is just the neck. Rotate away from it. And then you'll feel something tighten under your fingertips, and that's SCM. So you contract, press into it. Let the jaw go, lean a little bit into it, and traction the muscle forward and back. So let's use some imagery on this side. The muscle being fluid and pliable, like silly putty, changing its holding. And let's go over and traction it up away from the neck. And then here we go back. Let's go lower down toward the base of the SCM. Lean into it. And let's have the image that we're wringing out water. We're pushing the water that's in and out and making room for new water to come into it. Fresh, fluid, healthy water to flush out the toxins. And then lean away and traction up, breathing, letting the jaw go. And last time, go up now toward the ear. Lean into it. Traction it. If you like using the image, like you're stretching the muscle, like you could stretch silly putty, or you can post in the comments if you have an idea of another image that works better, gives you a more positive benefit for your muscle. And then over the other way and traction the muscle up. And then let your arm hang down and shake out and breathe and feel the change. Feel if you have more drainage. I can feel it because then I make that sound where you're like pulling the the mucus from where it is. And that sound, which is a pretty disgusting sound, let's face it, what that sound is doing is pulling the mucus from the tissues into your digestive tract, which is how it gets out. So even though it's not a pleasant sound, it is worthwhile because it is getting the infection out of your head, out of your tissues, and out of your body. The next part is inside your mouth. So you want to have clean hands and you want to have a tissue. So we're going to go inside the mouth and we're going to go in. So you go on the outside of your upper teeth as far back and as far up as you can go. Now, I'm going to do it a little bit just to show you, but I'm going to take my finger out because I'm going to be talking to you while you do it. You go as far back and as far up as you can go. Now, if you are a jaw clencher, this also helps with jaw clenching. But if you are a jaw clencher, if you have habitual jaw tightness, it's going to be crazy tight in there. So you don't have to press hard to create a benefit. Just having your finger there and doing a little movement, like tractioning out and in, a little bit up and down, just that is going to soften those tissues and help with drainage. So pressing hard will not, it's not like more pain, more gain. It doesn't work that way. I don't know if it actually ever did work, but it really doesn't work with this. Right? So you're just going out and in and moving around, and then take your hand away and breathe and feel the difference in the two sides. This is where the tissue comes in really handy. And you can do the same thing in the lower jaw. Like then it's the other hand going into the lower jaw, going in and down. And again, you're making space in the place where the cheek comes into the gums. And that again then creates drainage. And take your hand out, give your arm a shake, wipe your finger off. And let's do the other side. So you bring your other hand and on the top, you go as far back and as far up as you can. All right, far up. And then you relax. You breathe and you relax. And you remember, again, and if you're new, if you're doing this for the first time, you are a visitor in a strange land. It's like you're going into someone's house for the first time and you would not barge in. You would wait to be invited into another room in the house. So this is a new house, it's a new friend, and you want to make friends, you don't want to alienate. So you're going to wait to be invited, which is another way of saying don't push hard. The benefit comes just from being there, from breathing and feeling. You'll be creating drainage, you'll be letting go of tension. It'll relax your jaw, it'll create opening in your whole skull, which will in turn create sinus drainage. And take your hand out from that spot. Breathe, feel for the benefit, wipe your fingers off. And here we go on the lower on that side. So you go on the outside, as far back and as far down as you can go, and you do the same thing. You just gently, you're just tractioning the tissues. You're being an explorer, being like the Jacques Cousteau of your jaw and your mouth, discovering new places with a sense of, if you can, a sense of exploration versus I just want to get this over with. Because let's face it, if pushing to get stuff over with work to be a really different world. But if you're with it, if you really feel it and with it, then I find we create change. And that's so worthwhile, creating the change. Take your hand out, wipe your finger off, feel the benefit on that side. And the next place is up at the top of your mouth. So you're going to use your thumb and you're going to go up. If you feel there's two palates in your mouth, there's what's called a hard palate and a soft palate. So the hard palate, it goes from right behind your teeth. If you bring your thumb in and go back, you'll feel where the hard palate ends and the soft palate begins. And the place you're going for is right at the back of the hard palate. So you're going to press in and up. You're going to go up with your thumb and just gently press. And again, if you're doing something like this for the first time, it can be really tight. So you don't have to press hard to create the change. When I taught this to my sister, my twin sister, the first time. She said she felt it helped, created so much drainage that she felt like it was like having insider trading information. So I hope it's the same for you. And you press. Then you go along that edge of the soft palate and the hard palate, like toward your teeth on one side. Just move a little to the side, press up, move a little to the other side, keep going toward that side, all the way to the teeth. And then go back, maybe take a little break. Bring your hand down, wipe your thumb off, breathe. Feel the difference in the two sides. And here we go. Second side. So you can bring your thumb in, or you can use the same side thumb. Go in, go to the back of the hard palate, press in and up, and going at a diagonal toward your teeth. So I find, breathe, I find it feels good to do that. It just opens things up. It feels like there's more space in my skull and in my brain. It's so relaxing. And because we're doing this to create change in the sinuses, it creates more drainage. And let your hand come down, wipe it off, and feel for the benefit. So you can watch this video again. I'm going to do a video next of how to use inversions to create sinus drainage. So if you'd like to see that, be sure you sign up to be a member of my YouTube channel, and then you'll get notifications when the next video comes out. And if this was helpful for you, please share it with your friends who also struggle with sinus issues, because I'd like everybody in the world to know how to release sinus tension, and so to know how to create drainage. And then let's end where we began, like back here at the base of the neck, creating that channel for the mucus to get out. And if you have other things that you've come up with, like, did I leave anything out that you have, like, oh, this really creates drainage, put it in the comments so other people can find it too. Thanks so much for being a part of creating drainage, sinus drainage using your fingers. I hope you feel great and have a great day.